My first name's Michael, last name's Pappas, Michael, Pappas, Pappas.
And just let everybody know who you are and what you do.
So I'm a family medicine physician in New York City. I work both in the inpatient setting and outpatient setting, and then I'm also a member of Left Voice.
Of
a publication called Left Voice.
Left Voice, okay. Let's start with the notion that some hospitals, especially those in New York City, have sent warning letters that appear threatening to physicians and nurses and other staff that if you talk to the media, you will be disciplined and potentially terminated. Why don't you talk about that?
Yeah, hospitals have been sending these letters out, or whether it's letters or there's kind of these like underhanded comments, or there's a vibe of if something happens, something might happen to you, so you should basically stay quiet. And the hospitals kind of claim that that is for patient protection. That's all about the patients, and that policy is there to protect patients. I think the first thing I'd want to say is I think that's absolutely comical that this is to protect patients. I think it has nothing to do with protecting patients. HIPAA laws are to protect personal patient information. They are not in place to protect workers actually talking about risks in their workplace that might be risks to themselves or to patients. So I think that that's the first thing. I think I just want to say that anybody who ever hears those types of claims from hospitals needs to automatically think that that's just the hospital trying to protect its brand and trying to protect basically the patients, trying to protect its brand so more patients come into the hospital and they can make more money. So that's the first. I think that there's a lot of that kind of like fear mongering going on to keep healthcare workers from speaking about their poor working conditions. And the last thing I'd want to say about that is just that I think it even extends beyond the healthcare center. So I am of the belief that health extends outside of the clinic or hospital setting, that are where we're living socially, and those types of things affects health, and people need to take control over that, to take control over their health. And workers in the United States have been targeted for speaking out. So, for example, I am in complete solidarity with workers like Chris Smalls at the Amazon factory in New York, who were fired from their job from organizing because they didn't have appropriate protection in the workplace. And without appropriate protection for any workers, whether it's healthcare workers or outside of that, it's putting people at risk of spreading the virus, and then more people getting sick and coming into the emergency room or coming into the hospital where I will inevitably see them.
And just so everybody knows, I interviewed a doctor in an ER in Chicago recently, and he sort of blew the whistle on what they're dealing with, not really attacking his company in any way, shape, or form, just giving a reality check on what they're dealing with. And he caught some hell and high water after that interview, but he was not fired. So, and I just, I want to make it very clear to everyone watching this right now. You can come to me if you have a problem, and your identity will be protected and not revealed. I guarantee you that. And if there is a hospital which threatens you for speaking up, I'd like to know about it. Are you treating COVID? Please.
Sorry, can I just make one comment about that? I actually just saw this morning that I think it was a nurse who's part of NISNA, the National Nursing Union, who actually posted that nurses are now being protected under the National Department of Labor under whistleblower laws for actually speaking out about their workplaces. So I think that that's just another thing that workers need to note, that this is something important to bring up. And I think it's great that you're willing to even speak about this, because I think that unless people, are willing to expose this and talk about it, things will continue.
And listen, to the point Michael brings up, that may be the case, but it may not be the case where you can verify and confirm it till you blow the whistle and make sure nothing happens to you. In the meantime, I give you my word. And if you don't come to me, just go to someone else who you believe will keep your information confidential. The bottom line is lives are on the line, including those of first responders. And so find yourself someone who will protect your identity, who you can trust to tell your story. Let's talk about treating COVID patients. Are you treating some?
Yeah, so basically I work to clarify my position, I am a resident physician. So I am a family medicine resident physician, and when I am working in the hospital, our service that typically has 20 patients on it, our inpatient service, we had to recently cap that to 32, increase that cap to 32 patients. Out of those 32 patients, the last that I heard, 25 patients are COVID positive. So that's a great majority of the patients that are COVID positive. I was just in the hospital last week doing what's called a cross cover shift. So I was on overnight treating COVID patients and non-COVID patients. They specifically what our residency has been doing, which I don't think is all residencies are doing, is we are cycling residents in the hospital 1 week on, 1 week off, because there's a lot of new data coming out that the increased exposure to the virus increases the amount of viral burden that somebody has. So basically, the longer that you're in the hospital, the longer that you're working with COVID patients, the larger chance of having an increased amount of virus in your body and then having worse outcomes. So we are cycling residents in and out of the hospital in hopes to keep them as safe as possible.
So the same with you. You're doing a week on, a week off.
Yeah, so I'm actually starting my week on tonight, and I'll be doing a shift from 7 p.m. to 7 a.m. Those are actually the documented hours, but it'll probably be much over 7 a.m. for 1 week, and then I'll be out of the hospital. Prior to that, I've been called in for just one night shifts here and there or covering, emergency covering. We actually had a resident recently who was working. He had been working for 2 weeks, the chronic stress and those types of things. He actually had his heart started pounding. He actually went into atrial fibrillation with what's called rapid ventricular response, which is a life-threatening illness. He had to be taken from the floor where he was working down to the ICU part of our emergency room. He had to be treated there, and then I was called in for backup to cover him for the rest of the day to work on the floor. So that's the degree of the workload that residents are experiencing currently in the hospital.
What hospital do you work at?
I work at Mount Sinai Hospital.
And what is your PPE situation?
So our PPE situation right now is that you hear about these brown paper bags, and I saw in your last interview the ED physician had his brown paper bag. We also get our brown paper bag. Physicians get their little lunch pail that they take into the hospital that has one N95 mask in it. It has a plastic face shield. Our PPE situation is actually that we get one N95 each day. So each day we get an N95 to use, which in any other work setting would actually, if I wore the same N95 every single day, I could be fired for that, because it would potentially expose me and it would potentially expose other people in the healthcare setting. So, but even with that setting, how appalling that is, that's actually better than a lot of other hospitals in New York City. So there are other hospitals in New York City where people get one N95 for a week, or nurses will get one N95 for 1 to 2 weeks. So that's the degree that, while our PPE situation is still very bad, it is actually better than other hospitals, which is appalling, I think, overall at the degree that we're at currently.
Talk to us about the burden being placed on residents, and I don't mean by the virus, I mean by the workload that is required and what is happening to them.
Yeah, I'm glad you asked that, because I don't think that that's very covered about how the degree that residents typically work in the hospital. So resident physicians are considered training physicians. So that's the way that hospitals kind of get them into their hospital. Resident physicians work an average of 80 hours per week. That's their work hour limit. That is deemed by an organization called the ACGME, and they've discussed that as a humane amount of hours for residents to work. So they limit those hours to say, this is the healthy amount of hours you can work. Now, it's key that 80 hours per week is actually 80 hours averaged over 4 weeks. So that means if this week I were to work, let's say 60 hours, next week I could work 100 hours, and that is still fine to be working in a hospital. When you average, none of us are doing this.
So just time out. Your connection broke, and I didn't hear you for about 10 seconds. So the last thing I heard, the last thing we heard you say was, so if I were to work.
Okay, so if I were to work 60 hours this week, next week it would be okay under ACGME rules and hospital rules for me to work 100 hours. So that is, they average those hours per week. So that's to say that since I am working this week and I will be off next week, I'll just be doing outpatient things, 2 days in the clinic. in the outpatient clinic, I could work an innumerable amount of hours in the hospital, and that is completely fair under ACGME rules. Actually, under the pandemic, there was an announcement made, especially in New York. Governor Cuomo had his executive order that says hour limits for residents actually are just gone. So even the 80-hour work limit is just gone. Part of the reason why this is concerning, besides even outside of its pandemic, the emotional toll that takes, the physical toll that takes, is if you think about it, for residents working in the hospital who are working this amount of hours, as I discussed earlier, if you are being exposed to coronavirus over and over again, there's a higher chance of you increasing the viral burden on your body and then you having poor outcomes from the virus. So I would say that is the conditions, those are the conditions that residents are working under. And the last point that I think is important to bring up is around the amount of hours that residents work and what hospitals say about that. So hospitals say that they are training residents. That's why we're in the hospital. I and many other residents are under the belief and are more and more becoming under the belief that we are cheap labor for these hospitals. So when you average out our salaries for the hospital and we're doing the amount of work that we're doing and all of the patient care that we're doing compared to another physician who's getting paid a much higher salary, it's very advantageous for hospitals to have resident physicians there and send them into the line of fire like this because they're such cheap labor for the hospitals. There are actually ICUs. I just got a report from a physician who's working in Washington, D.C., that are having interns care for a majority of the COVID patients that are there. So interns are first-year residents, very cheap labor that they can push them into ICUs and have them working consistently.
What is Left Voices? Is that a publication, a medical publication or something?
Left Voice is a publication. It's actually part of an international group of publications. So it's a publication that actually really tries to cover worker struggles and workers actually coming together to try to expose abuses in the workplace and coming together to take control over their own workplaces. So Left Voice covered what happened at the Amazon action. Left Voice actually covered recently myself and other frontline healthcare workers. We formed a group that we're calling the Frontline Workers COVID Task Force. And basically we organized an action in front of Mount Sinai Hospital to call for the more PPE and more medical supplies. But also in addition to that, we were kind of trying to shed light on the fact that this crisis that we're currently experiencing, to our frontline task force conclusion, is a result of how our economic system has functioned and our for-profit healthcare system has functioned. And it's really leading to the death of frontline healthcare workers along with patients.
So it's interesting. You work at Mount Sinai. They are, look, I think every hospital is doing the Lord's work to get what they can done to save lives. I had a doctor at Mount Sinai send me pictures where you guys are putting up patient pods in a public area near the food court. But they're doing that because they need to. And interestingly, Michael, the hospital sent out a memo to providers, you may have gotten this, which addressed an article in the New York Post. And the hospital kind of shamed the Post and said, well, shame on them for publishing a picture of nurses in garbage bags. That's not what it was. And, you know, the Post sensationalized it. And we in the moment, I thought, I wonder if the hospital's telling the truth here. Mm-hmm. And I just left a Brooklyn hospital, the ICU, a couple of days ago. We'll be reporting on that soon. And when I walked into the ICU, nearly every nurse I saw was wearing a garbage bag. So I'm cautious that hospitals are doing what they can to protect their brand, which includes shaming the media, shaming you guys into not saying anything or saying it's not true once you do say it.
Yeah, I mean, absolutely. Hospitals, and I think that this gets to the center of how our healthcare system has functioned. When you have a healthcare system that predominantly is encompassed by large healthcare organizations and these large hospitals that function as large corporations, their bottom line is key. health is put secondary to that bottom line. So what that means then is that you need to protect your brand at all costs. You need to make sure that your workers stay in line. You need to make sure that, like at my hospital, you do not let workers unionize. So they have not let residents unionize. NISNA, the nurses are unionized, but resident physicians are not unionized. You need to make sure that workers do not take control over their own workplace and actually speak out, because that's very dangerous. So what do? You attack media, companies that are trying to expose these types of things. You directly try to threaten healthcare workers, and you directly try to create a culture of fear so healthcare workers are not willing to speak out. And, I am of the thought process that if I'm going into the hospital and I may get coronavirus and there's a chance that I could get very sick and die, I do not want it to be on my conscience that I didn't speak out about what's going on in these hospitals. I would rather get sick and die knowing that I spoke out, whether or not I'm targeted, whether or not I lose my job, especially when there's a setting currently that right now, one of the hospitals in New York that is targeting its healthcare workers, that there aren't enough PPE, like Mount Sinai, that's talking about all the time how all of us are in this together. All of the healthcare workers are in this together. They'll send out emails to us about how they're so grateful for the work that we're doing and everybody's in this fight together. I think it's peculiar how everybody's in this fight together when it's also reported that the heads of hospitals like Mount Sinai are hiding in condos in Florida right now, when healthcare workers like myself are going in every single night putting ourselves at risk. So I don't think we're all in this together, nor do I think that we're all on the same level of this. Workers are being sent into the hospitals, being exposed, being put at risk, and the leaders of these for-profit institutions or not-for-profit institutions that function like for-profit institutions just want to protect their brand.